Hi, my name is Meron and welcome to the ethical and legal aspect of patient safety. Today I would like to start with a story of a young boy named Louis Blackman. He's a soccer player, saxophone player, he is a writer, he's an actor and a top student in his school. But after 2 months from his 15th birthday, he went to hospital to perform a minimally invasive procedure to correct a defect on his chest wall. After his surgery, he went to an adult unit for further follow-up. Meanwhile, he was developing a severe pain. So the staff was administering him an IV pain medication and as well Toradol every 6 hours. They keep increasing the dose in order to control his pain. But these so many painkillers was affecting his breathing and his oxygen saturation go down and they put him in a pulse oximeter. On Sunday, which is the third day, Louis started developing an abdominal pain. They said this is due to constipation. But his belly was distended, his urine ceased, his bowel sound ceased, his heart rate goes up. Since it was Sunday, the only available doctor was an intern, and the family requested an attending physician. But a resident came and confirmed the diagnosis is constipation. Meanwhile, after 2.5 hours, Louis went into cardiac arrest and died. An autopsy on the next morning has showed there is a perforated duodenal ulcer, which is one of the common side effects of Toradol. So when they analyzed Louis's case, they have seen an inability of the staff to identify reclining patients, and as well, there was young nurses and residents that were left alone on the floor to perform such kind of job with an inadequate training. So there are so many kinds of cases that result in failure in the healthcare system. So one aspect is patient safety. Patient safety is very important. The World Health Organization has defined this patient safety as the prevention of errors and adverse events to a patient in the healthcare system. Organizations in the US like the Department of Health and Human Services, the National Joint Forum, and the Joint Commission, they all identified a patient safety goal. For example, Joint Commission, every year they established a patient safety goal to address different healthcare settings, including hospitals, ambulatory care, and behavioral health. So the main focus of the Joint Commission was on sentinel events. As we all know, sentinel events are errors or a series of errors that leads to days or permanent harm or a severe temporary harm. Besides that, Joint Commission has developed a typology of harms other than the sentinel events. Like adverse event, there will be a no harm event, there will be a near miss or a close call, and hazardous conditions. And again, the World Health Organization in 2004 established a patient safety committee that works to improve the safety of patients worldwide. So the World Health Organization used a conceptual framework like this, which is intended to be used as a standard guideline to identify the different factors that are contributing to a person's days. This conceptual framework has 10 elements. They are incident type, patient outcomes, organization outcomes, patient characteristics, incident characteristics, contributing factors, detections, mitigating factors, ameliorating actions, and actions taken to reduce risk. Now let's take a minute and see how this conceptual framework can assist us in understanding the days of Louis Blackman. Classifying the incident type is one of the most and first thing. When we see Louis' case, there was a series of errors that brought a days. When you also recognize his age, that's one most important patient characteristic. In the case of Lois, again, they transferred him to an adult unit. That is one incident characteristic. Again, when the family was asking to notify the attending physician, they haven't. That is one contributing factor. So these are some of the most elements that are most important in this set of circumstances that are resulted in a preventable event. And I hope these illustrations will help us recognize how a structured approach like this will help us to examine the different factors related to a patient harm across multiple incidents. So I hope you understand it well, and thank you for listening.